Hi, Vincent. Welcome to this interview with the Healthcare Business Resource Alliance. Everybody, my name is Tony Cowan. I'm the Chief Executive Officer for the Healthcare Business Resource Alliance, and it's my privilege and pleasure today to be interviewing Vincent Crump. So please introduce yourself, Vincent.
Yeah. First of all, thanks for having me on, Tony. It's always wonderful to talk with people in different parts of the space and get different perspectives. Myself, I'm the CEO of Midline Dental Partners. We're a full advisory firm that focuses primarily on revenue cycle management and insurance relationships with practices. We do go into procurement and a few other items, but primarily live in the insurance world because it's the most difficult part of what we all do.
How did you get yourself into the dental industry as a specialty?
One of those things I never thought I'd find myself in, in all reality, was in retail territory space, and my family's always been in healthcare in different capacities, cardiology, oncology, and I knew the hospital setting wasn't for me, and I had an opportunity come up to step into dental, and here we are over a decade later, and I'm still doing it.
So my background is medical development and doing ongoing regulatory compliance and helping ambulatory surgery centers maximize their profits. In the dental industry, what types of steps and how do you ensure that if there is something innovative or something new that you support your clients in being able to keep their profit margins there and also keep an eye on the quality outcomes?
It's just like the clinicians. It's continuing education in the business space, making connections, going to summits, going to seminars, finding out what really is going on in the space. And especially with insurance, it seems like on a dime, they can change regulatory compliance on what you need to do to be able to get paid for the services that you do. So it's paramount to stay on top of that information.
So I used to track CPT codes and
Mhm.
know what specialty was going to be hot, whether it was plastics or orthopedics. Do dental practices have the same challenge of checking what the reimbursables are?
Yeah, and that's specifically what my company does. So, in relation to more so ICD style coding, right? What we look into is what is your demographic trend in the area? What is your market saturation of your patients with the related carriers? And then in the dental space, lease networks are the biggest thing. So you can optimize your specific carriers through certain lease networks. So you can adjust your write off to say the national average floats around 40%. If you use a lease network strategy and really know your MSA, your market saturation, you can push yourself down to 23, 24% of a write off. And I mean, 16% extra in profitability with no extra patient time or chair time is it's huge. So knowing those strategies, and then also as you spoke to, knowing the coding aspects to say what are insurances paying for? What are the things that you're going to tend to get denials on? What is the additional information you need to make sure you are getting paid in an expeditious manner?
Yep.
That's what we do. We coach on all of that.
How do you go through the maze of all the new medical devices and medical equipment for dentistry? And I remember when in my 20s, um, to get a crown, it was like you got a temp, and then 6 weeks later, you went and got the one that came in the mail. And now they're like 3D printing them in the office. How do you help your clients determine what's a good capital investment, what's not a good capital investment, and what their return would be?
So one, it's clinical skill more so than anything else. Do you actually have the hand skill set to be able to facilitate the new technology? If not, let's start there. The other side is the negotiation aspect of it. There is this balance right now between going, printed style of crown or CEREC milling where it's in office versus using a laboratory portion. But what I have found is dependent on what labs you're using and what your depreciation load looks like right now, you actually can be in a more advantageous position to do a scannable. So taking a digital impression and sending that to the lab versus CEREC milling in office. And there's other clinical aspects that some doctors, they want so much of a perfect product that I help them weigh that time balance perspective too, of your color matching, your glazing, you're trying to make sure it's absolutely perfect. How much profitability are you getting out of that appointment? So I weigh all of those facets with them. And I find it's about a 50-50. Some people go the CEREC route and they say, hey, I can hire at a good rate, have someone oversee that for me. It's going to be wonderful. Other people are like, I'd rather just scan it, get a modelless crown back. Let's negotiate that price down as much as we can.
Yep. Yep. I recently moved to Jacksonville and had to find a new dentist.
Mm-hmm.
Love the dentist, but the waiting room looks like it was designed in 1990.
Yep.
And how do you help one of your practices know, are they spending money that they're going to get a return on updating their practice, or should they leave it as it is and just sell their client base? How do you help dental practices negotiate where they're going to get the most investment return as they continue to grow their practice, looking towards the day where they're eventually going to want to retire?
Yeah, so no, that's a great point to bring up. And it really comes down to where the space is at with EBITDA multiples right now. And what does your valuated asset look like in comparison to where you are? So, yes, you do have to heavily weigh the antiquation of the office, but where I find you more so can get value adds is in equipment, not necessarily aesthetics. So if you are, and I actually just had a transition in Jacksonville over the last couple months that they were still film developing X-rays. That's still a thing yeah, I know. Still a thing in dentistry sometimes. And you look at that and say, well, if you upgrade your office to digital, here's your investment, here's the multiple that you can get. But with selling doctors, they approach the table usually 3 to 5 years before they're ready. And their opportunity to grow usually more so comes, light equipment, coding is the biggest thing. That is, they become what I call a watch relationship. So it's a patient they've seen forever. They've got, a huge silver filling that is leaking along the edges of it. It's called marginal leakage. And you can see stress fractures, meaning bite force over time has caused that tooth to break down. And then the patient, the hygienist asks, should we talk about number 14 today? Well, is it symptomatic? No. All right, we'll just watch it. And when it's bothering her, we'll come back and we'll do it then. But you look at that and say, if you up your diagnosis a little bit and start treating some of those things you would have watched, here's the quantifiable top line revenue difference. And this is what it means for your profitability. And then here's the multiple off of that profitability. So this is what you can expect to get in turn for it.
Yeah.
There's also some operation expense control that comes into it because, long-term employees, wages go up. You kind of let go of like, I'm buying the supplies I need. I'm not really paying attention to it. But, 5% of profitability on a multiple scale is huge.
Yeah.
So finding all those pennies really makes a difference.
Now, when you go into a new client, do you do a complete audit?
Yeah. Yeah. So I go through procedure code analysis. I go through all the operating expense measures and benchmarks against the national average. I look at their insurance contracting. I again look at, what do you have in remaining debt? What do you have in depreciation? Strategy wise, I'll say I am not a CPA. So that is typically where I bring in other advisors, just like getting into the legal aspect. Obviously, attorney is a better person to speak to than me, but I have the identifiables to say, okay, this is where you should have this conversation. And then this is how you should leverage it in the asset purchase agreement. So then your post transaction, we lower your liability as much as possible.
Yeah.
So I'm all about building a team of advisors, but yes, I go top to bottom, procedure codes, everything to do with insurance to make sure let's optimize. And it really is beneficial, honestly, more so on the buyer side of the world than it is the seller side of the world, where you see those ad backs and, you can get a really good deal because you can't necessarily buy something on prospective revenue. It's
Right.
not there for the, seller. So that's just a forecast. I would never pay price on a forecast.
Right, right, right. How do you support a dentist that's in a practice but wants to go solo?
Are you speaking to an associate that's wanting to go solo? Yeah, so that's actually more identification of two things. One, what type of dentist are you and what do you want out of your future? And two, what's the demographic that you want? So they have to make that decision of, do I want to do a from the ground up startup? And is that the right choice for me? And I build the culture the way that I want it and fresh slate? Or do I buy existing goodwill? And then, yes, there is going to be some of those transitionary pieces of working through cultural change with existing team members, patients being conditioned to being part of this philosophical way that dentistry is done. To me, I would rather buy the existing goodwill in the majority of the scenarios because, again, in those watch relationships, there's usually hundreds of thousands of undiagnosed treatment of people that are already committed to those four walls.
Yes. Yep. One of the things that we're really grounded in at the Healthcare Business Resource Alliance is that we have more in common than separates us in the healthcare industry. I can map on literally all the things you're sharing about in my years of developing clinical space for MDs. The biggest challenge right now that I see in the medical market side is staffing. What are you seeing on the dental side, and how can you support your clients on the staffing side?
So it's the same thing. It's strategy more so than anything else. And it's looking at your true patient capacity. What I typically find, especially in existing practices, is they're overstaffed in areas that they don't necessarily need to be. So let's say hygiene, for instance, seeing your patients for preventative care. Yes, people across the country need hygienists, but I talk to more established practices and I look at their trend outs and they're running at 80%, 75% capacity. So you either pick marketing to try and fill that capacity or you do a reduction and you do that based off of demographic. I lean more marketing in that sense. From the administrative side, outsourcing 100%. And usually insurance is one of the first things that I approach and say, hey, it's great that Susie's doing insurance for you, but you could literally have her doing 10 other things. And the amount you're paying her is about equivalent to what a person handling insurance for a 4 practice group is making. So
Yeah.
we find some of those wage rate opportunities built into existing roles.
Yeah. What are you seeing right now across the dental industry as the biggest challenge that dentist offices are dealing with?
Hygiene shortage is probably the biggest thing. And in all honesty, COVID really drove up the demand. So I have seen some unique, but what I believe are very plausible things to do. So there are some practices out there that are hiring new graduate doctors and bringing them in to run a schedule where they're seeing hygiene patients, but then they're also seeing simple restorative on specific days. So they're blending new grad doctor schedule because the other fight that's going on in dentistry right now is there's not enough private practice jobs to facilitate all of the doctors coming out of school. So it's this catch 22 of these private practice doctors want people with experience, but none of the private practice doctors are willing to give new grads the experience for them to be plausible candidates. Then in turn, the new grads are going to work for DSOs or what some people consider corporate, but in all reality, it's, national groups of practices.
Yeah.
And then private practice doesn't want to hire them because they're coming from a corporate setting, which philosophically may not be in alignment with what they want for their private practice. So it's one of those, you got to pick one. You got to pick either mentor or you have to be okay with coaching some of those habitual things they pick up from. I went into a corporate office. I had no other supporting doctor. I just worked my way through getting stuck as best as I could, and good, bad, and different. Those are the habits that I formed.
Yeah, you mentioned it. You touched on it briefly earlier, and it's absolutely true on the medical side. I've spoken with hospitals where their biggest challenge right now is they have senior surgical staff that aren't making what the kids coming out of the this is their first surgical appointment, and they're asking for more money to come in than their
Mhm.
senior staff is making. How do you
Yep.
deal with that from a consulting base to literally not lose your talent?
It's a challenge, and it's finding common ground, and I mean really it's negotiating down the new, and you might have to give a little bit of coin to the existing team to keep that retention piece. And what I speak to is how, when you look back, and just Indeed is a simple enough thing, not even farming out and doing events and getting a brand out there. How much money have you spent on Indeed? And they look at it and they're like, oh yeah, I didn't realize I'm thousands of dollars in just to running ads. And I say, okay, you give your hygienist who works 30 hours a week $2 an hour to stay, you actually made money, and you keep a good retention piece because it's a clinician that the patients know. So it's shocking when they think, I have to, like, this person's going to leave, I can't give them a raise, I'm going to have to find someone else, when they've already spent the money trying to recruit. So why not actually look at what's the overall amount that I have to spend between recruitment and my clinical wages to make this work? Administrative is a little bit easier, but yeah,
Yeah.
clinical is a challenge.
Yeah. I love, because you just illustrated one of the most important points about consulting to me, who's lived my entire life as a project manager slash consultant, which is, don't hire me for what you know you need. Hire me because of what you don't know you need. And it's
Yes.
invisible nightmares that your years of experience clearly give you a foreshadowing on of, yeah, that door looks good, but you don't want to open it because I know what's
Yep.
behind it. So let's save that and just move on. So,
Yep.
so that's awesome. So here's my last question for you.
Yeah.
Um, so Chat GPT is not going to be doing fillings, but how is AI? How do you see AI infiltrating and affecting the dental market?
You know, it is funny that you bring that up. So from the team development side, I'm 100% AI all the way. It has saved so much time and created so much efficiency. But right before this call, I actually just got off the phone with a client, and he went to a conference in Vegas and came back, and I told him, hey, you're using this specific patient management software, there's a couple tools to look into. He comes back and he's like, yeah, I immediately signed up for the radiographic AI that integrates in. Well, and it's I've worked with him for years. He's one of my retainer clients, and it's one of those like, hey, we've done well for so long, we're at that trust basis. But he's like, you weren't kidding me. He's like, it's $500 per practice. He has 4 practices. He's like, at our insurance reimbursements, if we do 4 fillings additional per practice of misdiagnosis, we pay for the software itself. And they actually, because it's a cloud based, he had the ability to pull up existing patient x-rays, and they did the demo within his software because it's the same
Holy
company.
cow.
And he was like, he was going through his preventative visits, and he's like, even I, a 15-year out doctor, he's like, I missed probably 11 or 12 fillings, or ones that I thought were lesions that were still in the enamel and not into the dentin. And he's like, and the AI makes it clear as day that some of those ones, it's like, I probably could watch it for another hygiene cycle or two. It's like, no, I should treat that now. That's the difference that it makes. And some people, I don't know if it's the same way in medical. In dental, everyone seems to be inherently frugal, that I always say they're jumping over dollars looking for pennies. And
Yep.
it's, I think AI is one of those things where it's new and people are iffy about it, but the amount of time you can save and work by using AI more than pays for what you're spending on the wage side.
Yeah. And I think it's changing so much in all industries,
Oh yeah.
especially those that iterate as quickly as healthcare and dental. We will be probably talking again in a year, and
Yeah.
it'll be a whole different landscape.
Oh yeah. Well, and as you said, even development side, the fact that you can take Chat GPT and then plug it into Synthesia, like the amount of time that it's taken previously to build a workshop and coach versus now, it's unreal the amount of time and great content that you can build that you can get out to more people.
Yes.
So it is. I'm excited to see where AI goes. I'm just hoping when one of them pushes and goes public, I pick the right one so that I can sail off into the sunset as quickly
Right,
as possible.
right. And one of my best friends who's deep into the AI conversation goes, enjoy it now while it's Napster, because when we all have to pay for it, we'll hate it.
Exactly. And that's what I'm hoping. I'm like, come on, pick Google and I'm done.
Yeah, that's right. Well, thank you so much for joining us today. Is there anything else you'd like to share before we sign off?
No, I just hope that I can help as many doctors as possible. I realized that being in the clinical world, you guys had negative time to even look into business and get the understanding of what you need to be truly successful. So never feel like you shouldn't reach out for help. We all need coaches, we all need trusted partners to grow.
All right. Well, thank you so much for joining us today, and we'll see you again soon.
Sounds great.